Hello, I'm Joyce Taylor, Chief Quality Officer at Lake Health.
And I'm Dr. Philip Brzezowski, Vice President of the Medical Staff.
At Lake Health, we complete the Universal Protocol checklist before any invasive procedure in the hospitals and our outpatient facilities. We also document the Universal Protocol elements in the patient's medical record. In this video, you will see correct and incorrect examples of how to perform the Universal Protocol in a variety of settings.
Following the Universal Protocol means that we make sure that we have the right patient with the right procedure on the right side when applicable. This is important to ensure the safety of every patient who entrusts their care to us. Protect our patients. Follow the Universal Protocol, and if you see someone not following it, speak up.
The Universal Protocol was created to address and prevent the possibility of the tragic errors of a wrong site surgery. Standardization of the Universal Protocol focuses on 3 critical steps. The first is a preoperative verification process. The second step involves the process and steps of marking the site. The third step involves conducting a timeout immediately before starting a procedure. The timeout is documented in the medical record and all steps are monitored for compliance. The actual operating room scene you are about to see is an excellent example that demonstrates each of the appropriate steps in a properly done timeout before a surgical procedure.
So we are ready for our official timeout.
This is date of birth 1/11/59, who's going to have a paniculectomy, vaser liposelection of the abdomen, vaser liposelection of the flanks, vaser liposelection of the mons, all bilaterally.
I agree. She has no allergies. She is an ASA of 2, and the humidity in the room is 38.7. Great.
The Universal Protocols begins at the first visit to our facility. The pre-admission testing appointment is the first of many times that the patient will be asked to verify their personal identification, as well as the pertinent information regarding the procedure, providing redundant safety checks throughout the process.
Hi.
Hello.
How can I help you?
I'm Margie Cooper, and I have an appointment here today for PAT.
Okay. Did you bring your insurance card and photo ID
Yes, I did.
and a list of medications with you? All right, that's fine, thank you. And I need you to just go over the top part of this, make sure that your name, address, phone number are correct, and birth date also, please.
Yes, everything looks correct.
All right then, thank you, and just have a seat.
Okay, thank you.
All right.
The attending procedure nurse will introduce themselves, ask the patient again to give her name and date of birth to make sure that it matches the orders and the procedure the patient is there for. They will then explain the pre-admission testing process.
Good morning.
Good morning.
Hi, my name is Janet. I'm the nurse that's going to check you in today and get you ready, okay, for your surgery. So tell me your name, please,
It's Margie Cooper,
and your date of birth.
6/30/50.
Okay, very good. I'm going to ask you a few questions related to your surgery to get you ready, okay?
Okay.
All right, let's get started.
All right.
Patient identifiers during patient transport is very important. There are several additional steps in patient transport above the normal protocol, which would include removing distractions, confirm allergies, confirm and food or dental, and answer any questions. Now you will see 2 versions of the patient transport, wrong one and a correct one. This scene is the incorrect patient transfer. It will demonstrate many things that can be done wrong in the transport area. See if you notice what is wrong.
Hi, honey. You all set for your operation?
Yeah.
Oh, great.
Take on Canada in the semifinals. That matchup will be.
All right, let's get going.
Will I get some coffee afterwards?
We'll see what we can do about that.
The Transport Patient Identifier protocol follows the same list as other areas but has a couple extra steps. The attending nurse will introduce themselves, then verify patient ID, verify date of birth, verify procedure, remove clutter and distractions, confirm allergies, confirm any food or dental. Be courteous and answer any questions. The Transport Patient Identifier protocol follows the same list as other areas, which is to 1. Identify the patient, identify the date of birth, and identify the procedure and which side if applicable.
Hey, Adam.
Hey, Tom, how you doing?
Good. I'm here to get Dr. Jones' patients, Miss Poppins.
Okay, sounds good.
Super.
All right.
Hi there.
Hello.
My name's Tom. I'm going to be the nurse taking care of you. I'm going to turn that TV off so we can talk.
Okay.
I'd like to look at your name band. Can you tell me your name, please?
Stina Poppins,
And your birthday?
4/25/79.
Very good. What procedure are you having done today?
You're going to be working on my knee,
Which knee?
my left.
Left knee. Very good. Can you tell me about medicine allergies?
Just penicillin.
Okay. Nothing to eat today?
No.
No?
plastic.
Any dentures we have to worry about?
No.
Do you have any questions that we can answer for you?
No, I'm okay.
Okay, well, let's get things started then.
Okay.
Thank you, Adam.
We're going to take you away to surgery now.
Okay, thank you.
Let's see what is wrong with this scenario.
Hi,
Hi.
I'm Ruth. I'm one of the RNs that's going to be in the room with you. How are
Nice
you
to
doing
meet
today?
you. Good, how are you?
Good. Can you tell me your name and date of birth?
Olivia Smith, 10/20/92.
Okay. And what is the doctor doing for you today?
A procedure on the left arm.
Oh, okay. Well, we have the wrong arm marked on here, so I'm going to go talk to the doctor and we're going to have to get this corrected and we'll be back, okay?
Okay, thank you.
During this surgery site marking scenario, the nurse followed the correct protocol by introducing themselves, asked the patient to give her name and date of birth to make sure that it matches the orders. However, the nurse discovers during the procedure part of the patient identifier process that the wrong site has been specified in the paperwork. To correct this mistake, the doctor needs to review all of the paperwork. They will then update the wrong site to the correct site while having a second person as a witness. The doctor will then confirm and sign the change. After the paperwork has been corrected, the nurse reiterates the patient identifiers, again asking the patient name and date of birth, then explaining the consent form correction before proceeding to mark the correct site.
Hi.
Hi.
Just tell me your name and your date of birth.
Olivia Smith, 10/20/92.
Okay, good. I did talk to the doctor and we did get the consent form corrected, so we do have on here that we were doing your left side.
Okay.
Okay? I'm going to go ahead and mark that. Okay, we'll see you in a little bit.
Thank you.
In the operating room, if the patient is already under sedation, the surgical team performs the timeout as a group with the physician leading the timeout. The team goes through the universal protocols, which includes verifying the right patient, the right procedure, and the correct side for surgery when applicable, and checking medical allergies. The team verbally agrees the information is correct to confirm everyone is on the same page. After everyone agrees, this would then complete the surgical team timeout.
All right, everybody listen up. Who do we have here? We have Olivia Smith, and we're doing the left carpal tunnel. She's marked, and she got antibiotics?
Yes, 2 grams of Ansep are in.
Okay, everybody agree?
He has no allergies, and I agree.
I agree. Thank you.
They're set.
In the cath lab, it is possible that the patient can still be lucid and therefore can take part in the patient identifier portion of the procedure timeout by answering the questions directly from the physician prior to starting the case. This is an example of an incorrect timeout. During this incorrect timeout, the physician asks questions that have the answer in them which would not allow the patient to state the answers directly to the doctor. It is important to remember to let the patient answer the question and not to ask leading questions.
Miss Jane Smith, how you doing today?
Good.
My name's Dr. Jones. We're going to be doing a left heart cath on you. Is that all right?
Okay.
All right, timeout's done. You can go ahead and give some meds.
Okay.
Another extra measure is to check patient wristband information before sterile draping occurs in the room.
How are you doing today, Miss Smith?
Good.
You're doing good? My name is Dr. Jones. I'm the one who's going to be doing your procedure today. Okay?
Okay.
If you don't mind, we're going to go ahead and do a timeout.
This is our official timeout.
And go ahead and tell me your full name.
Jane Smith,
And your birthday.
August 14th, 1979.
And what procedure are we doing today?
A left heart catheterization.
And who am I?
Dr. Jones.
Alright, is everybody in agreement?
Agree.
When a patient is moved from one area to another or to a procedure room, it is important to use the patient identifier procedure to make sure the right patient is going to the right room for the right procedure. This should only be done with a person-to-person handoff while confirming the patient name and date of birth before the transport person leaves and the patient is transferred.
I'm going to leave you right outside the store, okay?
You're just gonna leave me here?
Well, they'll be right out. They'll be right out. Don't worry about it.
Well, how do you know they'll be right out?
Well, from my experience, they come right out, okay? Take care.
Okay.
Good luck.
The procedure staff can also utilize the universal protocol and the patient identifier as an additional preliminary step in the proper identification of a patient before the procedure timeout takes place. The nursing staff verifies the patient name, date of birth, and the procedure against the written orders and the patient wristband for consistency and accuracy.
You're going to be fine. We're just going to take care of you right away.
Dr. Shirley, 3251. Dr. Shirley, 3251.
Hi. Here's your next patient.
Hi, I'm Kelly. I'm one of the nurses from endoscopy. Can you tell me your name?
Christina Poppins.
And your birthday?
4/25/79.
Okay, very good. I'm going to take you in here with me.
Okay.
Okay, good luck.
Thank you so
See you
much.
after.
Let's see what is wrong with this scenario.
All right, this is Kelly. She's going to be with us.
Hi.
Hi, Kelly.
Mrs. Smith, right?
No.
Aren't we doing a EGD on you today?
No.
Oh.
Oh, well, we better check the paperwork then.
Did you bring me the wrong patient?
I thought this was, oh, I'm sorry.
Oh.
We're going to go take you back.
I got to take her back.
Outpatient procedures such as a colonoscopy also utilize the universal protocol, which can also serve as an additional safety check after the patient has been transported to the room.
Okay, here we are. This is Kelly. She's going to be working with me today.
Hi, I'm Kelly. How are you today?
I'm good.
Can you tell me your name?
Christina Poppins.
And your birthday?
4/25/79.
Okay, and what are we doing for you today?
A colonoscopy.
Okay, very good.
All right, we're going to do our timeout, everybody. Okay, this is Christina Poppins. And your birthday?
4/25/79.
And we are doing what?
Colonoscopy.
Okay, everybody agree?
Oh, yeah.
Okay.
Good.
Dr. Schwartz, you ready? What? Okay.
The procedure timeout is led by the physician. All staff are focused on the information, and the patient is able to participate and state name, date of birth, and procedure, which is agreed upon by the team before the procedure begins.
Hi, how are you?
Good, how are you?
Good. I'm Dr. Schwartz. We met before. Hi, we're going to do a timeout. Can you spell your last name again?
Poppins.
And your date of birth?
4/25/79.
And what kind of test are we doing today?
We're doing a colonoscopy.
Great. We all in agreement?
Yes.
Okay.
When a patient is transferred from the EMS squad to the emergency room treatment area, 2 patient identifiers are required for patient safety, similar to an inpatient identifier. The 2 identifiers are the patient name and the date of birth, in addition to the vital signs. In the first transfer scene, you'll notice the EMS responder gives the patient name and her actual age of 40 instead of her date of birth, along with her vital signs.
This is Miss Smith. She's 40. She was working out, started having sudden onset shortness of breath, history of asthma, no allergies, takes albuterol as needed. Gave her 1 breathing treatment and high flow oxygen. She responded well.
In the second corrected scene, the nurse proactively asks for the correct patient identifiers, including the patient name and date of birth, along with the vital signs. This should be done every time.
Hey guys.
How's it going?
Good.
Patient became short of breath about an hour ago while shoveling snow in her driveway.
Can we get her name?
I'm Smith.
Do you have a birthday?
December 20th. Was it 1982? Patient's anal times 3. Before oxygen or pulse ox was about 85%. Blood pressure is at 130/70. After oxygen, bumped up to 98%.
Caregiver hand hygiene is one of the most important ways to prevent the transfers of germs in the healthcare environment. In addition, as a courtesy to the patient, the caregiver should announce their presence and ask permission to enter the patient room. Let's review a number of possible incorrect interactions as well as the correct variations in the inpatient care setting.
Good morning, Mrs. Smith. Is it all right if I come in? Thank you. Hi. Hi, can you help me over here? Sure. Thank you. Have a nice day.
Like the universal protocols for patient identifiers and procedure timeouts, there are several variations on maintaining consistent mandatory hand washing practices in the healthcare environment. Hand washing can occur outside of the patient room before entering with waterless soap, or inside the room at the sink with soap and water, or using a waterless soap dispenser. But the important thing is that caregiver hygiene must be practiced before and after patient contact and before the next patient is contacted. Let's see what is wrong with this scenario.
Good morning, Mrs. Smith. May I come in? My name is Karen and I'll be caring for you this morning. Good morning, Mrs. Smith. May I come in? Thank you. I'm going to take a moment to wash my hands before I come over to see you. How are you this morning? My name is Karen and I'm going to be taking care of you. Do you have any other questions for me today? No? All right, thank you. Do you have any other questions for me today? No? All right, thank you. I'm going to go over here. And if you do have any questions, please don't hesitate in giving me a call. Have a nice day.